So are you preparing for your UK NHS Band 5 or Band 6 interviews or Ireland nursing interviews but not sure how to make your answers stand out? So the secret exactly lies in how you use and elaborate your responses or how you are going to present them. And in today's video, I'm going to show you how exactly you can do that and you can impress your interviewers and you can land in your dream job. Hi everyone, I'm Yadu Krishna and welcome to channel Malayalam Nursing Couple. So just to let you know, if you're new to our channel, so here we help nurses like you to build your successful nursing career, either for your interviews, exam preparations or anything. Okay, so in today's video you're about to watch a recent mock interview session which I have organized for our interview candidate, and in this mock interview session you can clearly see how the candidates struggle to elaborate their keywords and how they failed in their previous interview and how they gain confidence with this mock interview session, or how to elaborate their answers or their responses in front of the interview panel. So I'm going to show you some practical examples so that you will be able to elaborate your responses or improvise your keywords or elaborate your experiences or previous practice, how you fit into this job role you're interviewing for. So this is how you need to sell your answers or sell yourself. Okay, the reason I thought to share this video with you guys is mainly because I do lots of interviews every day, either if it is a mock interview session or a real interview session. I do sit in the interview panels as well. So I felt like there's something was missing or some kind of important part was missing from your interview answers. Okay, and most of our interview preparing candidates, they get that essence because I mold them directly into that way how their responses should be. Okay, those answers need to reflect your practice. Okay, so we call it as a reflective practice. Most of the interview panels will be expecting those from your answers, because in your interview you're not going to demonstrate anything. You're not going to demonstrate your cannulation skills, your venipuncture skills, or your ventilator setting skills, or how you're going to give the IV, because there is no mannequins or anything in there. Okay, you are simply going to tell about yourself, or the questions or the scenario questions or the core questions, your clinical knowledge, your clinical skills, your nursing skills, how you're going to make a clinical decision according to the patient safety, or how you're going to provide a patient-centered care. Okay. Along with these, you need to include all your value-based answers as well. So now please watch this mock interview session. I haven't included the whole interview session because it's confidential. So I have only included a part of the mock interview session which will be very useful to you to understand or to gain an insight how exactly you should be presenting it. But watch the video and note down all the important or relevant points. So how's everything going on, Jenny?
I feel like I'll collapse all the answer, I think, because continuously every word like prioritizing safety, safeguarding, like these words are running. I don't know what answer for what question. Let me try.
Okay. So how was your experience in the interview?
Yeah, both the interviews they gave feedback that I look nervous and I don't feel confident. But I have answered all the questions. But what I did this time, I have collect the questions what they have asked and did some notes. I think they need elaboration. I should not stop. They are expecting. Once I stop, they are. Do you want to say more? Explain more, like that. They asked.
It's a bit tricky because I've been interviewing some of the candidates last week. Okay, so I've been going through with some of the questions. So they have answered me all the key points in single words. So I have asked them a question like, the patient is very nervous in going for a preparation for a surgery, and they are refusing the treatment. Okay, so what will you do in that scenario? Okay, that was my question to one of the candidates. All right. So directly her answer was, I will talk to the patient. Okay, so it was like everything was in point by point. All right, she remembered everything, but she mentioned everything. So she said, I will talk to the patient, then I will inform the patient regarding the benefits of the surgery, what will be the complications of the surgery. Okay, then if patient is not understanding what is the importance of surgery, I will try to convince them more by including more senior members from the team. Okay, and if they don't want to proceed, then I will document everything, the reason for not having the surgery, and I will escalate to the surgical team.
Okay.
Then she stopped. Okay. I have also stopped. I haven't answered anything or haven't said anything. Okay.
Okay.
What do you think? This was the answer what she has given to my question. Is it right, or what do you think? What's your evaluation?
I think this answer is enough, and it's clear. I don't know. Maybe I feel nervous and I'm repeating the words, I think.
No. Don't go to your side now. I'm just saying, what do you feel with this answer?
Yeah, it's clear and accurate, I think.
Okay, so if I'm in the panel, I won't give any, like I will give marks. If it is out of 10, I might give 2 marks.
Oh,
Do you think what's the reason?
you need elaboration.
Yes. So this is where this is where everyone gets stuck. Okay.
Mm-hmm.
And this is why I always say important in watching that video, understanding what exactly. So yes, keywords are there in here. Also, the candidate said many key points in there, but the panel want to know whether the candidate know what exactly they are saying, or what exactly they are showing to the patient. Okay. So in this scenario, the patient is completely frightened regarding the surgery. Okay. There might be different reasons. Okay. It can be because they are expecting a cancer. It might be their fear. They might be thinking they might get die, or they might die during the surgery. Okay. And there won't be anyone to look after their family. Okay. They might be having some different news or information from their friends or family members saying that this is a like crucial surgery, anything can happen. So and patient might not had any idea regarding what exactly is going to happen next. They haven't got proper explanation. So there are different reasons, okay, or concerns or underlying problems within the patient. Okay. So what did the candidate did here? So she said she will talk to the patient. How? What are you going to talk to the patient? So the panel want to know how you're making the patient reassured, or where is your compassion? Where is your empathy? Where are you showing the respect to the patient? How are you maintaining the patient's dignity? So if you're saying the words, okay, I will respect the patient, I will maintain their dignity, I will maintain the confidentiality. How? This is where everyone gets stuck and you get fail in the interview. Okay. The points are there, but you need to clearly explain how these things works. Okay? So have you explained in a proper way in your interviews?
No, I just on the first interview, I I said what I memorized, and using the
Exactly
same
like what I have told you, like just the keywords. So you have mentioned the keywords to the panel, isn't it?
Yeah, and I repeated the answer. Like for all the questions, I used the same points.
Same point. So
Yeah.
what exactly happens here is, Jenny, so if I'm saying, so the points, do you remember the points I've said to you? The candidate has said, I will talk to the patient. So rather than saying that way, you could have said, I will speak to the patient. So first thing, you will approach the patient in a calm and focused way. Okay. Then you will try and find a space which is more private. All right. So the very important thing is you need to clearly mention to the team, you need to build a proper trust within the patient by maintaining a proper communication. These are the points you need to clearly like mention in there. Okay. So I need to build a proper trust with my patient. So for this, I might need to find a proper space, a private space, so that the patient feel more confident. They feel they are being cared for. Okay. Then I will listen to them. I will understand their concern. I will acknowledge their concerns, or I will address their concerns. Okay. It might be different issues they might be having. I want to know what exactly is bothering them for refusing the surgery. Okay. Once I have understood the proper root of the cause or root of the problem, then I will try to explain them in a clear, precise manner without using too much medical information or too much medical words. Okay. Then you will clearly say what are the importance of having the surgery, how much this can affect your quality of life or your disease progression. Okay. And what can happen if you're not having the surgery. Okay. How much it can impact your quality of life. All right. So you need to clearly explain. All right. So then you will check with the patient whether they have understood everything. Okay. If you want to provide more information, I will check with my colleague or a senior surgeon or a senior anesthetist, whichever is needed, and a senior nurse in charge to come and speak to the patient to give more information to them regarding the procedure.
Okay.
So by that way, patient will understand in a clear manner what exactly is going to happen for the procedure. Okay. So once this has been done, or in case. So then there is an if as well. Okay, the answer hasn't been finished yet. So then you say, after all these convincing measures, if the patient is not interested to proceed for the procedure, I will respect their autonomy. I will respect their independent decision. Okay, which is very important in saying that point is very important. Okay. Then you need to clearly say, okay, what are the complications or what are the things which can happen if you are refusing? Okay, and always tell them, if anytime if you change your mind, please let us know. We are more than happy to proceed with the procedure. Okay, give them all the options in there. Then you need to mention, then I will escalate to the surgical team, I will escalate to the anesthesia team, I will escalate to my nurse in charge. I will document everything clearly, what I had the conversation with the patient in a proper way, or I will give the proper handover to the next team as well. Okay, inform to the family, inform everything to the patient. So that's how you answer this question.
Okay.
So that candidate, the answer which I have told you, yes, that was an answer. Okay, I completely agree with that, and you completely agreed. What you said was, yes, that was the proper answer, isn't it? So what do you understand, or what do you think, how I have answered it, and what was the problem in there?
You elaborate well, and you have shown that what else we have to do as a protocol wise, and
So this is
everything
how,
is clear.
yeah, exactly. So this is how you are showing compassion, empathy, respect, kindness, maintaining dignity, everything without saying those keywords. Okay, so elaborate means, that doesn't mean you need to repeatedly saying a similar sentence.
Okay.
You need to be clearly saying, okay, what is your problem? So this is why sometimes we use the STAR technique. Sometimes if it is like kind of a scenario based question or something, understand your situation, okay, then check what is your task, what are your actions, and what is your result. Okay, you need to think of those points as well in some of your answers. But questions like this, they want to know what are your values, or how you're going to treat your patient, or how you look after the safety of the patient. Okay, is that clear?
Yes.
So now you got a clear picture how need to elaborate an answer, right?
Yes.
Because I thought this will be the best thing to start with, because to give you an idea, but the panel don't know whether you understand those points or how you going to perform those things in the real life scenario. Okay, is that clear?
Yes.
Great. So can we go to the first question then?
Yes.
Okay, wonderful. So I'm skipping the all initial bits and everything because we have already gone through some of the questions. I'm just going to directly go to the scenario-based ones. Is that okay? Yeah.
Yeah.
So I hope you got a clear picture or clear insight how exactly you need to elaborate your answers, isn't it? So in this 15 to 20 minutes of mock interview session, so this mock session or mock interview class extended up to nearly 2.5 hours. Because of this reason, this candidate hasn't got any kind of feedback from their previous interviews. Okay. So what I normally do is, while I do a mock interview session with any of these candidates who are going for their Band 5 interviews or Band 6 interviews or Ireland or nursing interviews, I will literally sit with them, explain them everything in detail, and ask them each questions one by one and give the feedback after each question and answer. Okay, so that's how they need to improve their confidence. They will understand their weaknesses, they will understand their strengths. Because your interview panel want to get a team player to blend with their team or to maintain their patient safety or provide a patient-centered care. Okay, so you really need to sell yourself in this interview. If you got a wholesome bunch of experience, it doesn't matter if you are not verbalizing it in a proper way or you are not elaborating it in a proper way. Okay, so I hope you got a clear idea now. If you are someone who's looking for interview preparation and to gain your confidence or gain your presentation skills, styles and everything, you can contact us for further assistance and guidance. Along with that, if you're preparing for your NHS Band 5 or Band 6 track job application assistance, we do provide support for that. And if you're preparing for your Ireland, Australia or New Zealand nursing interviews, we could also help with that. Because getting a job in this current situation or current scenario is very tricky and very competitive, because you really need to be a good competitor in this competitive world. I have also shared lots of feedbacks or testimonial videos from our recent interview candidates, which you can watch in our YouTube channel. It is really important you need to practice it perfectly. And if you struggle to speak through it or present through it, then yes, you need an assistant. So how you need to evaluate that? You literally need to go through each questions and answers So you need to record your answers in your either in your mobile phone or a recorder or something. Then you need to watch it, okay? Then understand how you're answering it, okay? Or how your way of presenting it. If you think like you need support, because what we do is once you get enrolled for our interview preparation, you will get access to an unlimited interview recorded video session, which is exactly similar to the mock interview session which I have conducted or shown to you in this video. So you will be able to see 1 to 25 questions in that video, okay? So you will be able to access it through our website, Mallu Nursing Couple. So if you go to www.mallunursingcouple.com, you will be able to see those videos in our website. You can purchase it. If you struggle to purchase, you can contact one of our coordinators and they will be able to help you, or just put your inquiry through our contact us page. Put all your details in there, your WhatsApp number, country, which subject or which course you're looking for, either it is interview preparation, clinical or non-clinical, nursing interviews or Ireland interviews. Just select your subject and put your details in there. Then one of our team will be more than happy to help you with. Okay, so once you got the access for the interview recorded videos, you literally need to watch that 1 to 25 questions. It might be a 2-hour video, it might be a 5 hours video. It depends which one you choose. And what you need to do is, from the beginning, the initial thing is you need to completely watch that video. Simply finish that video initially, okay? Then come back again, because this video is watchable at any time. If you're working, if you got a break, if you're traveling, you simply need to listen to that video, okay? So if you felt this video was very useful to you, then please do like and share to your colleagues so they can also prepare for their upcoming nursing interviews, okay? And also don't forget to subscribe, and we will be posting lots of videos similar to this, so you'll be able to improve your confidence levels, improve your answering skills, your technical knowledge or clinical knowledge and everything day by day, okay? Also comment your feedbacks below. Is this how you expected for the nursing interviews, or have you had any kind of feedback from your previous experience or previous interviews as well? Just comment below. Or if you want me to do any specific topic related video, just mention in the comments as well, then I can prepare according to that, okay? Also, just to let you know, we do have free interview preparation groups in WhatsApp as well. I have put all the free WhatsApp group links in this video's description, so you can click on the link and you can join or enroll to our free WhatsApp group, okay? So see you all soon with another informative video session. So till then, it's me, Krishna, signing off from Mallu Nursing Couple. Bye.